I worked with a particular patient many years ago who'd had PTSD symptoms for over 20 years. He'd been a soldier during the Troubles in Northern Ireland and had been exposed to a bomb explosion where a number of his friends died and he was covered in their bits of body. He had nightly nightmares for 20 years until he came to see me and we started some treatment together. And in a matter of weeks, all his symptoms had gone away. So a man who'd been tormented by his trauma for over 2 decades, I saw become thoroughly well. And that's what impresses me about the treatment and the hope that no matter how long you've had the symptoms for, there are effective treatments available, but you need to come forward and ask for help. Hi, my name's Pete and today I want to talk to you about PTSD. Stereotypes that suggest that patients with PTSD are violent, unpredictable, incompetent, or in some way to blame for their own trauma are all really unhelpful. Myths are dangerous because they get in the way of people coming forward to get help. That's why we've got to challenge these things. That's why we've got to talk about PTSD and other mental conditions. PTSD stands for Post-Traumatic Stress Disorder. It's a mental condition that can happen after significant scary events happen to an individual, and maybe something like that's happened to you. All of us would be scared if you suddenly have you're involved in a car crash or someone attacks you, and those responses you have initially are normal. But if those difficulties last for more than 4 to 6 weeks, then you may develop PTSD. PTSD's got a number of symptoms that you may recognise. Your sleep may be disturbed, you may be on edge, you may have difficulty relaxing, you may be thinking about what's happened even if you don't want to, and you may be having bad dreams or nightmares about it, flashbacks, re-experiencing phenomenon as if the trauma is happening again. All of those are symptoms of PTSD as your brain tries to make sense of the horrible thing that you've been through.